In women who are pregnant, the teen population has the highest rate of illicit drug use, and it is 20%.
1 out of 20 kids now. Can you imagine 1 out of 20 kids being exposed to some kind of substance that might cause problems for them long term? The child, of course, doesn't choose to be exposed to this and has been called the innocent victim of this incredible prescription drug epidemic that we have.
These little ones are literally crying out for help. The increasing trend is worrisome and a little frightening from our standpoint. An unmanageable problem if we don't do something about it.
Our culture is so drug-oriented because we are a quick fix solution culture. There are pockets of prevention and natural healing in the country, but that's not who we are as a culture. We won't put up with any pain or discomfort for more than 5 seconds without reaching in the medicine cabinet for fast relief of. There's no real mystery to me as to why people begin to use drugs. It is because they work for a while. When people get drugs from their physician, they believe that their doctor wouldn't prescribe anything that would be dangerous, that they could lose control of. And the phrase that I hear over and over again from people is, "But I got these from my doctor." The thing that we're trying to get across now is that prescription drugs are drugs. Wherever you get them.
20 years ago, we saw more heroin and cocaine and the illicit drugs, and now it seems like the more commonly abused drugs are all your prescription drugs. The Vicodin group, which is the hydrocodones, which include Vicodin, Lortabs, and Norco. We also see quite a bit of Percocet use, which is the oxycodone, and that's also kind of with Oxycontin, because Oxycontin is the long-acting form of oxycodone. We are seeing more Suboxone. We are seeing more methadone use, especially from the chronic pain clinics. 90% of the people we see are actually on legally prescribed drugs. We're the biggest user of opiates in the world.
What percent of oxygen is she on? She's on still 50.
There has been a sharp increase in the number of babies that are admitted to the neonatal intensive care unit with withdrawal symptoms.
And we stopped the dopamine, right?
Yes.
Stop that medication?
Yes.
Okay.
It's about 10% of our population.
He's twitching again. It's upsetting that I can't take him home. It was hard for me to sleep at night, not being woke up by a little screaming baby that I just had. It's been rough. It's been a rough road.
If you ask any mom that has a baby in the NICU, that's the hardest day that she ever has because it just doesn't feel right, and it kind of breaks that bond. They feel a lot of guilt. It doesn't matter why they're on the narcotics. If they are prescribed or if they're taking them illicit, they still feel a lot of guilt because they feel like the reason their baby is going through all this is because of what they did.
It's very upsetting because I know I caused it. I mean, I didn't have a choice. It was either I come off of medication and possibly lose my baby, or stay on the medication and him possibly go through withdrawals. But I know that he's going through it because of what I done, so he's hurting because of me.
Hi, welcome today. How are you? It's Dr. Landwehr. The goal is treating pain, not just giving pills. The problem we have with opiate analgesics in pregnancy is not their safety while you're pregnant, but it's more of an issue of, what happens to the baby after the baby's born. That's where, working hand in hand with the pain clinic is trying to determine what is the best therapy for these patients if they're planning on getting pregnant, and what's the least trauma we can do to the fetus. I mean, it's a pretty tough part of my job is I'm dealing with two patients at the same time. I'm trying to take care of the mom on this side and try to do the least amount of harm to the baby on this side, and that's where the juggle for maternal fetal medicine always comes in. It's one of the unique specialties where we have to deal with two people simultaneously. You can see all three vessels. So you can see them wrapping around, see it right here, where you can see the two arteries and the vein in between. I'd say 90% of our patients never intended on getting addicted to pain medications or to opiates. The pain clinic people, not that they're doing anything wrong, is concentrating on their pain, kind of forgetting that it's a 22-year-old ovulating, sexually active female. And, where I hope to educate, more of the private doctors or the pain clinics is let's get them on birth control then, because most of those patients who are being treated for chronic pain are unintended pregnancies. It's rare that a mom who's being treated with methadone or being on OxyContin is purposely out trying to get pregnant because she knows it's not a good thing to get pregnant while she's on these medications, truly. But the problem is the only doctor they're seeing is their pain doctor, and they're not seeing their OBGYN or their family doctor, and the pain doctors are very uncomfortable talking to them about their contraceptive management.
Neonatal abstinence syndrome is a syndrome of drug withdrawal that we see in babies who are born to mothers who are physically dependent upon drugs, especially narcotics.
All right, little buddy. Are you awake? Time to wake up.
With neonatal abstinence syndrome, we see it occurring at about 2 to 3 days after delivery, because at that point, the baby's drug level has dropped low enough for him to be symptomatic.
Was his bilirubin still low today, since we turned the light off?
The clinical features and presentation are twofold. One is neurological, so you'll see the baby very irritable, jittery, tremulous, having very tight muscle tone, sleeping very poorly between feedings, sometimes just unconsolable crying, high-pitched cry. And then gastrointestinal, the baby is vomiting, not tolerating feedings, loose stools, diarrhea. 5 years ago, this was a rare occurrence, and now it's just an everyday occurrence.
Okay, let's unwrap you, see what you're doing today, huh?
I can't even think of hardly any time that we don't have at least one baby withdrawing. And it just keeps escalating, and I don't see an end to this at this point. To have babies like this is very challenging.
The wipers on the bus go swish, 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 swish.
We have the cuddlers, which are retired women that come in and hold and swaddle the babies to calm them down and to comfort them.
A nurse usually has 3 baby assignments, and if they're all upset at the same time, it's very hard to get to all of them.
Well, let's get the cleanup going here.
The cuddlers model great parenting skills to the moms that might not have anybody to model that. Our goal is to make sure that the mom and the baby have a great bond and are able to go home. That's our main goal, is to make sure that they understand their behavior in case their withdrawal symptoms get worse.
If a baby tests positive for drugs in our nursery, it's an automatic referral to Child Protective Services.
If a family, an infant, and their mother become involved with child protection to get services, protection, safety, then our department's required to provide services to that mother and baby.
So how was the night?
It was a good night.
Everything went pretty well. No major issues?
No.
Good.
We just want to assure families early on that we're going to partner with you to help you get back on the right track and that you're going to have a healthy, safe baby.
You already know from what's gone on throughout the hospitalization, but talks about what we may still be facing upon going home.
Pregnant women who are using drugs and addicted are not forced to give up their babies. It's only when she's not cooperating or making sufficient progress to parent her child that further court intervention would occur concerning termination of parental rights.
Our primary emphasis is on the child, because that's somebody who has their whole life ahead of them. So when Child Protective Services is called, it is simply to help that child. It may be that the parent simply doesn't have the resources that are necessary to care for that child, or doesn't know about what's available in the community that can help them to care properly for that child. And so the role of Child Protective Services is to try to get whatever services are necessary to help this child. Their role is not to take the child away from the parent. Their role is to try to keep the family together by providing whatever is necessary.
The goal is to have babies that are going to be able to develop normally, to hopefully be in a drug-free environment, to have parents that feel successful in their parenting. The goal is to have babies grow up to be ready for school and to function there, and eventually, healthy, achieving adults in our community.